I'm Soledad O'Brien. Welcome to Matter of Fact. While the healthcare debate has been divisive, to say the least, the American public is pretty clear on what they'd like to see. A little unity. A new Kaiser Family Foundation poll shows 71% of the public want a bipartisan solution to health care. That breakdown includes 41% of Republicans, 91% of Democrats, and 72% of independents. Hope of a GOP-only bill is fading away despite the efforts of Senate Majority Leader Mitch McConnell. Showing his frustration, McConnell delayed the start of the August recess by 2 weeks in the hopes of getting to a consensus.
And we simply, as a result of all this obstructionism, don't have enough time to address all of these issues between now and the originally anticipated August recess.
Ezekiel Emanuel, an architect of the Affordable Care Act, says the law needs an upgrade, but not a complete repeal and replace. Dr. Emanuel outlines his ideas in his book, Prescription for the Future. It's nice to have you with us.
Great to be here.
You've been in meetings at the White House while the House was working on its health care bill. Describe for me a little bit about what those meetings were like.
Well, we were discussing the substance of health care and whether the Republican proposals, which have stayed largely the same despite some tweaks, were a good idea or not a good idea, or what alternatives might be viable.
And so were those contentious meetings? Were those ideas good ideas from your perspective?
Well, I have been on the record saying that I don't think the Republican proposals, first of all, they're not bipartisan, and they had criticized the Democrats for not being bipartisan, and now they've actually taken that being partisan a whole nother step forward. They haven't even talked to the Democrats, whereas the Democrats talk to them. And I find the Republican proposals actually, anytime you're thinking about throwing 22, 24 million people off of health insurance, not something very appealing. And most importantly, as I point out in the book, there's no proposal or no idea in their proposals to actually control healthcare costs. This moment in American history is about affordability of the healthcare system, and the Republican proposals don't actually improve the affordability. What I discuss in the book is, we need to think through how to actually reduce healthcare costs, because that's the only way on a long-term basis to actually make healthcare affordable. And then I outline different ways that is possible.
Let's talk about some of those different ways in the overall philosophy. How do you reduce healthcare costs under what already exists in the Affordable Care Act or Obamacare?
First, we need to remember that 84% of all healthcare spending is for people with chronic illness, people with heart disease, cancer, emphysema, asthma, diabetes. We need to focus on those patients. Second, you need to incentivize doctors and hospitals differently to keep those patients healthy, to not wait for them to show up at the office sick, but to actually reach out to them and keep them healthy.
So what changes would you then specifically make to the marketplaces, et cetera, et cetera?
So there are, I would say, 4 or 5 major changes that we could do that would easily stabilize the marketplace and make them much more thriving. The first one is that we have to announce that we're going to actually give the cost-sharing subsidies. These are subsidies to people who are relatively, from average income and below, to help pay their deductibles and help pay their co-pays. Insurance companies are worried that the government's not going to pay that bill, and they're going to be stuck with it. Second, we have to get this reinsurance. So if insurance companies enroll a lot of sick people, they are actually compensated for that, and that was in the bill in the Affordable Care Act, and Senator Marco Rubio and the Republicans stripped it out. Third, we have to announce that we're going to enforce the mandate, right? It's the law of the land. Republicans should be for enforcing the law of the land, and that will get more people into the marketplaces. Fourth, we can incentivize insurance companies to go into those counties that don't have a lot of insurance companies. And last, advertising targeted at young people to tell them there is health insurance available, it's cheap, and there's a mandate and you'll pay a penalty if you don't have it. Ask health policy experts who are conservative. They agree these are the kinds of changes we need, and they would do a huge positive job. They would stabilize the markets and make sure that they're thriving.
So you're hopeful.
One of the things that makes me optimistic is if you go around this country, there's a lot of innovation, a lot of entrepreneurial spirit, and you can see a lot of these improvements on the ground making a big difference. What we need to do over the next decade or so is more rapidly change how we pay doctors and hospitals and let these experiments that have sprouted up around the country really blossom and spread. And I think that's the key. And, you know, again, my book is a small attempt to take that and show people so that they can adopt these kinds of changes.
Dr. Ezekiel Emanuel, nice to have you.
Great to be here. Thank you very much.
You bet.